Dr. Nash. Do you want to tell me a little bit about this 52-year-old female with a history of polycystic ovarian and a hysterectomy? Was that a complete hysterectomy?
No, just uterus. So the no oophorectomy, just the uterus.
Okay.
Yeah. And she really, it's an interesting case for me because she really came in complaining of um, the dense breasts, that she said she's never had a biopsy, but she's been getting routine ultrasounds uh, post mammography, and they're recommending every 6 months mammography and ultrasound, and she wisely doesn't want to do that every 6 months. Um, so she really, I don't know much about her case. She was referred in as a consultation, from another physician. So I'm not going to be following her so much, but I just thought, these findings were pretty remarkable in terms of the breast picture, because her breasts looked so, they almost looked like implants. They were so taut. The skin was so taut, like they had a ton of edema.
Hmm.
And I just had never seen breast tissue like this before. I mean, I don't know if that's what super dense breasts um, will look like, but they, and she said even the doctors that she's been working with, and her OB-GYN that's been recommending the mammography, um, said that there's just this incredible density. So that's why they keep, searching. And she's obviously doesn't want to keep getting mammograms, or else she's going to end up with a problem. So,
That's really interesting that they want to search until they find it, and lo and
yeah,
behold,
yeah,
after so many curies, she's going to have it. So,
right,
so
exactly.
does she have calcifications?
No, they haven't seen any calcifications, and that's why there haven't been any, biopsies. There's been no one particular area, and the ultrasounds always come back just fine. But I found it really interesting. The woman was really, really sweet, but she broke down in tears about 3 times during the exam, and it was all related to emotional stuff. I mean, she wasn't able to have her own children, but she thankfully adopted 2 kids, and she has a great relationship with them and all of that. But, the PCOS piece was, what was, I was wondering what the connection to the breast health might be. And she clearly seemed to have, like, just very, very sensitive emotionally, and, talking about various things that, were not happy events, but not necessarily even about her own life. She just really was like holding back tears like three
Hmm.
times. So there's definitely something emotional going on, and
Oh, of course. Some
yeah,
is it, we could surmise what that was by, her inability to have her own kids or something, but that's just
yeah,
guesswork. So
yeah,
let's look at the
totally.
thermogram. But as you see on the breast, she's only got 5 out of 12 uh, criteria, so that puts her in the very low risk group. And what do we see? We see a side difference that's significant towards the right, and then she has this blocked sternum point, which is another alarm point for the chest region, not necessarily specifically the breasts, but for the chest. And then I don't like this point going off on this left side of a hyporegulation continuing to show itself, and then this kind of pointing to this point in the uh, inferior lateral aspect of the left breast. So what I would aim for is to unblock these points
Hmm.
and try to get rid of the side difference. And we can see, well, what are the factors that are adding to that stress? And you see that in the signature bar graphs here, the lymph, some organ, some heavy metal, and some possible tooth or sinus or lymph that's creating a focal disturbance. And the side difference is significant. We'll see that down here. So we see there is stress to the breast tissue. There is a reason for some kind of long-term concern. However, I would try to make it so that she's just getting ultrasounds every 6 months and mammograms possibly not. Now, so we have our work cut out for us on the thermography. Um, if we want to know that side difference of the breast, we look down here in area 11 and 12, and we can see way over on the right here, these are the averages of all the points on the right breast and all the points on the left breast after the cooling period. And that's a 0.8 degree difference, which is significant. So anything more than 0.5 becomes a little significant. 0.8 is pretty significant, and then 1 or more is absolutely significant. She has only this hypo point. So that one on the left breast is can be seen right here, and
Yeah,
that's the B point, which is in that lateral inferior aspect, and you can see the side difference with your eyes.
right.
So we usually are a little bit more concerned with a warmer breast. However, in DCIS, and that may mean either calcifications or in fibrocystic disease, that usually causes a coldness
Okay.
like this. So I would assume that her fibrocystic disease is a little bit more on the left.
Okay.
So as we clear things, what you want these to do is to equalize, and we want the side difference to disappear. And we see right here, as we start our procedure now, look, this is the perfect thermogram. So look, I want everybody to look at this. This glabella is going up slightly, about half a degree. This glabella is going up slightly, about 0.3 degrees. So this is the look that we all want. So if you are getting different things than this, even though it's valid, we want you to do one of two things. Make sure that your patients are sitting for at least 10 minutes before the start of the test. They're not they're not fighting with anybody, or they're not reading the newspaper with all the horrible news these days. And um, and then the room is not too cold. So there's a big misunderstanding, or it actually happens once in a while, where people think that the room should be cold. Well, that comes from the old infrared camera methods, where they would even, sink your hands into some ice water. The room only has to be a normal room temperature, which is 20 to 22 degrees Celsius, or 68 to 72 degrees. But it's even a little bit better to be on the tiny bit of the warmer side, like 72 or 22 degrees, than to be colder. And so whatever you are doing here is really great. Do you
Good.
do you cool the person with them on a carpet, or on a towel with their feet?
Nope. I got that thermometer that you told me to get. It's this big giant thing, so I'm right at 70 degrees, and I just make sure the patient is sitting in the room quietly, like she was actually sitting in the room for probably a good 20 minutes.
Okay, so that's
Um,
great.
yeah.
So
So
now
can you
we're
just
yeah.
so can you just review what you did, that first glabellar, you want
Yeah,
it to go
yeah.
up?
This all comes from the ideal thermogram.
Okay.
Um, so the ideal thermogram, all of the head values go up except for the maxillary by about zero point 0.2 to zero point 0.3 degrees, like these points in here, and the glabella for sure. And both glabella readings, the one before the whole body and before the dental. So there's
Okay.
two glabella readings, and those should imitate each other. That's the ultimate. And we can't expect that on all patients, and it doesn't invalidate the thermogram unless both of them are cooling more than 1.2 or warming 1.2, and they're mirroring each other. They're going in the same direction and being that different of a temperature from the first value. So now we want to get into the case, and we see a lot of blocked regulation in the neck. So we're looking for these black second measurements. and we see they're kind of scattered here on the left side. Every even number up here, whether it's T or L, even numbers are the left side, odd numbers are the right side. So here's a left side, here's a left side, here's a right side. Then we get into the thyroid, which acts a little bit different. So we have 31% blocked regulation in the lymph. The sternum, you see that block point? That's what we showed you, and you see that hypo point here. That
Right.
makes that block point makes the 14.3. And then the liver, you see this blocked liver 3 point. That makes the other 14.3. And then we see the small intestine here and the large intestine here making, well, it's showing the small intestine is a 9.1. And what is it when we have from areas 3 through 6, when we have values in these places, like here we have 3 out of 4 of these 4 possible places, that is indication for
Heavy metals?
yes.
Yeah. Okay.
So we see it, and we see since they're kind of low percentages, then there probably is heavy metal, and we don't know how severe that is. I'm just
Okay.
trying to outline that.
Yeah.
So now that we see that the cubital fossa, the left is very blocked and the right is almost blocked. So there has to be some kind of peripheral circulatory deficiency because they're both a little bit on the block side. So we think of the circulation to both hands and then feet also, we can assume there's something circulatory going on.
Oh yeah,
And
she did have this really curious symptom where she got these burning bands of discomfort, but like a burning pain every night when she laid down to go to bed in the prone position around her ankles. So
mm,
that's what I thought, that she had some peripheral circulation issues, and so
yeah,
that the cubital fossa points would point to that as well.
yes, very
Okay.
good. Now, of these block points that you see, what are you most concerned with? What do you think is the biggest concern? And think of the uterus and the ovaries and the breast. So
The
uterus and,
liver?
yes, the
Yep.
liver being blocked is
Yep.
crucial. So that's the block point. So now we're carrying some good ideas. Now we have some ideas. We have some lymph blocking. We have this liver point, and we have something going on in the chest that we want to clear up. And the gut is looking a little bit interesting because when you see that one colon point is so different than the one next to it, then
Hmm.
that's the signature for diverticulosis or diverticulitis.
Oh, okay.
So that'll come out. So really that's the summary of the first step. Then the second is the range of readings. Now look at these very cold ethmoid
I keep
points.
seeing this all the time. I've seen like 5 or 6 people with these really cold ethmoid points.
So when they're on when if they were at very different levels, you might think more virus, but this means that the overall prognostic category is a little bit towards if the lymph system. So it's going to be a bit of an uphill battle. You have to open up her lymph system, and to the degree to which these points are cold means that those are older chronic problems that are going to be harder to reverse.
Okay.
So Dr. Ross said, who's the god of all this, says that it's all cold means that it's old.
So that doesn't have anything to do with the pituitary, Dr. Beelan, those points there?
No,
Those cold
the temples
temples.
are
Okay.
pituitary.
Okay.
The, um, so then we look. So the span goes from 29 degrees, and there's one. The hottest point is 36, so that's 7 degrees difference, and it's all in the head. So we're going to want to know what's happening to the regulation in the head, which means the teeth as well, and that's showing that when some of the worst signs are towards the head region. But
Hmm.
you have to clear the liver as well. Don't forget about the liver. And next we go side difference. We go cubital fossa. Those are a little bit of a side difference, but more significant is their overall blocked regulation. They're almost the same side to side. And then we run up to the chest. So the side differences are cubital fossa, chest, head, teeth, and breast. So chest, these are the same, these two heart ones. Here's a little difference in these heart points, but
Yeah.
not that different. It can mean she might have some cardiac functional deficiency where the
Hmm.
cardiac output is a little bit less, or she could have some cardiac signs, but this is very mild. And the sternum point, since this heart is not very bad, and you see that there's this big side difference in the breast, I'm and also the sternum block and the side difference in the breast. With I tend to think that this sternum being blocked is pointing towards the breast more than it is anything with the heart.
Okay.
But you know, this is alerting you to the whole chest. That's what I want to tell you, and not just to the lungs and heart and pericardium. Now, side differences in the head, they don't exist in the maxillary or the ethmoids. They do exist in the mastoid. Side difference in the mastoid. Mastoid is for neck and jaw. So we're going to be interested in whether there's TMJ, or I always ask people, do you have TMJ? And a lot of them say no. And of course they do. They just, haven't really been analyzed in that way.
Hmm.
But many know that they have neck problems. People who have neck problems know they have neck problems, and a lot of, I would say, 70% of the time, with the maxillary asymmetry, there's problems with the neck.
Hmm.
With the temples, they're very symmetrical, as well as the CP, which is the internal carotid circulation. So those are perfect. And then she has this below baseline and blocked frontal sinus, so you may ask her if she has some left sinus problem, or maybe she has a septal deviation that might cause this to look this way. So the side differences as we continue are 32.0 on the upper right jaw and 32.1. That's only 0.1 difference. It's not nothing. And then 34.1 and 33.6. That's a 0.5 difference in the lower jaw. And you can kind of see that this lower right goes up to these higher readings. But we're going to let the dental section and the breast section speak for themselves. So now we have an idea of treating the lymph, treating the liver. There might be something in the gut. There's something circulatory and neck. Um, the 30.8 block in the neck lymph is enough for us to think there could be a focal infection in the tonsils or in the neck lymph. Next, we're going to go to the front page of the report, and we're going to look at moderates and severes. So here's the moderate heavy metal. Here we have the adrenal being moderate, and here, and then we have the TMJ or neck, where we can't exactly know which one. Moderate lymph, and the sternum block
Right.
is an alarm. And we have this hepatobiliary being the liver, but this actually, we're changing this because it should be moderate when one block point of the liver comes. So never ignore a blocked liver point.
Yep.
And then we see this pelvic toxicity, which can be either residual to the surgery, leaving adhesions, or something still with the ovaries since they left them in.
Yep.
And then we have this kidney toxicity, which is shown by hyperregulation in the kidneys. And so when you begin to treat her, make sure that you get a nice drainage for the kidneys. You can see it starts here and it comes all the way down. So we're talking about a big hyperregulation, 1 to 3 degrees in both kidneys, and the blocked liver. So you need to free up her detoxification capability before
Yep.
you would even begin any kind of detox of heavy metal, and then also the lymph can be treated. So Um,
What findings on the graph point to the adrenal stress? I mean, in general, is it
it's the No, it's not. It's the overall ability of the sympathetic nervous system to react, and whether when there's a lot of hyperregulation, then there tends to be adrenal exhaustion also, and that's combined with the overall baseline temperature, which has an interaction with the thyroid, because the adrenal and thyroid work together to create the overall baseline temperature. So a little of both of
it's
those.
yeah, it sounds like it's a complex
Yeah,
evaluation. Yeah,
well, some of the signatures are very complex, and that's why the report is, some of the equations are like 5 lines long because they're
right,
considering 10 different factors.
right.
So this took, you know, 3 years for us to put together with finding the right programmers that could handle it with their abilities. So um, now I like to go to the 2D diagram, and you can see that you show the patient this blocked regulation in the neck. There's some inflammation, and we want to free up this blocked regulation in the chest. And here's that blocked liver point, and here's the abdomen that's running a little bit uh, funny with this small intestine point being blocked, which can also mean food intolerance. And then, so this is something to show the patient, and then in 1 month, say, of therapy, you should see, 30 to 50% of this clearing, especially if you do a really good liver detox.
Yep.
In the dental, we luckily don't see any speckled look of the tooth, which means two teeth that are next to each other are very different temperatures. But we do see the dotted look, which means that we have a loss of the overall sine wave. That's the gradual change of temperature from the back of the mouth to the front. And so you'll see this upper right has these three teeth that are lacking their response, which can mean a infection in the jaw. And I can show you this on the graph. In the upper right, you can see these 3 points don't change at all in their first values.
Hmm.
And that's the reason why we get a little bit of a concern, but they're regulating well. So if we see this and we see an area we may be concerned with, it might be this upper right area, but with the teeth more towards the front because of this coldness and this paradox. So, and then on this upper left side, we see all of these are paradox, and um, they're coming in a slight curve, but they all look very different than the right. So I would examine the right jaw for a possible problem, because the the tonsillar lymph, see, we had the identification in the breast of the focal disturbance, right?
Hmm.
So it's got to be coming from the teeth or the sinus or the lymph or the ovary, and it could be coming from the ovary. So we see this breast side difference in the priorities, and then we see the heavy metal, and then we see the lymph. So already we're off to a running start in the kidney.
Yeah.
And then we would just add in the liver because that was not quite coming over the border to identifiable as a moderate or severe. And now, it's a very important thing anyway, whenever you see these dotted teeth of the lack of the sine wave, to think, are any of these possibly contributing? Is there something here contributing? So we see the correlation or correspondence of the organs and meridian systems to those teeth. And we look over the things that we think could be contributing, and we try to make a connection.
Hmm.
Sometimes it's possible, sometimes not. Here we have the right breast. The stomach, of course, is connected to the breasts. Um, and the the TMJ maybe, but that was only the lower jaw. So I would kind of want to look a little bit more towards the tooth number 3, which is here. International, it's 1-6. And you see the side difference. The black teeth are toxic teeth that could be residual from amalgams or materials or gum disease. So again, we see this side difference. We see the sternum block, we see this hypo point, but we only see 5 out of 12, which is good. It makes me in a state of somewhat relief. And here are the organ tissues from the liver. Here are the heavy metal. Here are the distant related focal. We're not sure. It could be lymph. It could be ovary. It's not really that strong in the teeth because we should see the speckled look.
Mm-hmm.
And then we have the lymph. So I would adjust my therapies accordingly. And then this is just these bars are just to tell you how to double check yourself, to really check to see whether you're on the right path. So we look at these moderates and severes, and I circled these because it's very important that if we identify a signature that's fulfilled, that we know how strong that is, because a signature can be fulfilled, but there's only 1 out of 3 factors. So it's only a minimal, whereas we want to know how strong that is, and that'll give us our priorities for treatment. So we want to do something with these moderates. There's heavy metal, adrenal, jaw or neck, and then the lymph. The head emphasis is created from an index of the lymph in the clavicular region that has to do with lymph flow. So that's not, it's not the telltale sign above anything else that the problem is really all related in the head, but it gives you an idea that there are problems that you should not ignore happening in the head region.
Yep.
And in this case, I'd be more inclined to look at the teeth in those areas that could correlate to the breast. The sternum block is an alert. The liver is any blocked liver point should be in the moderate. The pelvic toxicity is probably adhesions, but I would still be curious to know if the PCOS is still there to any extent. And then the kidney, you want to start drainage. So as we then finish our confidence level and increase that, and we have some communication with the 2D image to the patient, then we can be pretty clear that this is kind of where we want to go with the addition of the liver and looking at the teeth.